Welcome to Pre-em.
Pre- and post-operative education in multilingual for orthopedic wards by Faculty of Nursing, Chiang Mai University.
Upon admission to orthopedic wards, patient will be provided first consent for medical treatment and surgery.
This form include blood transfusions and CPR.
Second, consent for personal data disclosure.
Third, acknowledgement of necessity for medical devices, prosthetics, medications, and special diagnosis procedures.
This form contains essential information that patient must reveal in order to grant consent for their medical care.
Pain management.
Next, we will explain how to rate your pain using the numeric rating scale or NRS. Please rate your pain on a scale from 0 to 10. 0 is no pain. 1 to 3 means mild pain. The pain is present, but you can still talk, move, and rest normally. 4 to 6 means moderate pain. The pain becomes more noticeable and uncomfortable. It may affect movement, sleep, and pain medication may be needed. 7 to 10 means severe pain. The pain is very strong or unbearable. It may be difficult to move or rest. Immediate pain control is required. Please tell the nurse immediately if you start feeling pain. Don't wait until your pain is severe. Also in recovery room. Once the nurse knows your pain score, the nurse may 1. Give your pain medication through a vein, so the medication works faster. 2nd, reassess your pain about 30 minutes after the medication is given, and your vital signs will also be checked at the time. Please tell the nurse if your pain improves, your pain stays the same, or your pain gets worse. Finally, please call the nurse immediately if you experience these following symptoms: increasing pain, dizziness, excessive sleepiness, and difficult breathing. Before the surgery, the nurse will instruct you not to eat or drink anything including water for a period of time. This is important because during anesthesia, your swallowing and coughing reflex become weaker. If there is a food or liquid in your stomach, it may come back up and enter your lungs, which can cause breathing problem or lung infection. Therefore, it is very important to follow the NPO or nothing but oral instruction for your safety. Proper skin preparation is essential to reduce risk of infection after surgery. 1 day before surgery, in the afternoon, you have to take a shower and scrub your body with antiseptic solutions. But if you cannot do it by yourself, the staff will do it for you. Also wash your hair, shave your mustache, and cut your nail. In the nighttime, if you didn't defecate, the staff will provide laxative Rectal for you. And after midnight, you shouldn't eat or drink any food or drink to prevent aspiration during surgery. In the day of surgery, the staff will remove your hair around the proposed surgical areas and scrub and paint the surgical areas by alcohol-based chlorhexidine gluconate solutions. Once the solution dry, the doctor will mark the incision site with blue pen. And you have to check the integrity of the wristband, and you have to wear by yourself, or in some case, the staff will insert the urine catheter for you before go to the surgery.
I would like to explain the anesthesia you may receive for your procedure. The type used depends on the surgery, and the anesthetist will discuss with you what is the best for you. One option is general anesthesia, which is given through an injection or a gas. It works quickly and makes you feel asleep within a minute. While you're asleep, a breathing tube will be placed in your throat to help you breathe, which may cause mild throat irritations, and it is recommended to take plenty of water to help reduce irritation. You may also feel drowsy for up to 24 hours. Another option is spinal block, which is an injection in your lower back that makes the body numb from the waist down. You may stay awake or be given medication to help you relax. It is important to stay still and avoid sudden movement during the injection. You may feel numb or weak, according to the dose of anesthesia and procedure. If you are unable to void yourself, please notify the staff. Regional anesthesia or a regional nerve block is a technique where local anesthetics are injected near a specific nerve to numb a targeted body part, such as an arm or leg. The injection is given near your nerves, often using ultrasound to guide and make it safer. You may stay awake, but you won't feel pain in the end of that area. Since it is regional block, you may have less side effects, such as nausea, vomiting, and faster recovery. After the operations, you will go to the recovery room. Nurses will monitor your vital signs, such as your blood pressures, level of consciousness, complications from anesthesia, and pain. The time you stay depends on your condition.
Thank you for watching. We hope you get well soon.